Expert panel is recommending that adults under the age of 65 be screened for anxiety every year, including people who may not appear to have symptoms. So what led to this proposal? Joining us is Dr. Newfield, Chair of Psychiatry with Hartford Healthcare, St. Vincent's Medical Center. Dr. Newfield, welcome.
Thanks so much for having me, Lisa. Good to be with you.
Great to have you. So tell us more about the Preventative Services Task Force, their proposal, and what's behind it.
Thanks so much. So again, it's a group of experts that are appointed by the Department of Health and Human Services under the Surgeon General. And what they've seen is that there's this growing problem with anxiety that's not being well enough addressed in the primary care settings. And so they're recommending that adults between the ages of 19 and 64 get screened for anxiety to determine, how at risk they might be and what we might want to respond to. These are so far preliminary recommendations, but we see that they're probably going to be similar to the final recommendations.
All right, you're a chair of psychiatry. Do you agree that all adults should be screened for anxiety?
Well, I'd first like to just let everybody know what anxiety is. It's a clinical term for worry, nervousness, or fear that is without a reasonable basis or is out of proportion to the subject of the anxiety. And it often feels out of control to the person who's experiencing it, and they may be having certain symptoms that are affecting their functioning either at school or at work or in social settings or at home where they have activities to care for, and they might be experiencing sweating or palpitations or GI disturbances, sexual or urinary dysfunction. And so in years prior to the pandemic, the medical field was realizing that many people were suffering from anxiety disorders that were under or unrecognized and therefore undertreated. And so I fully agree that, the task force recommendations make a lot of sense and that people go for screening so that they don't have to go suffering without treatment.
And what screening tools are in place?
So there's a variety of questionnaires. Some are named after the people who invented them. So you'll have the Beck Anxiety Inventory, or you'll have the Hamilton Anxiety Rating Scale. But a few of them start with the letters G, A, and D, which stand for Generalized Anxiety Disorder. And there's a variety of scales. So you might have to answer a few questions in order to determine your level of anxiety or your risk for anxiety disorders.
All right. And doctor, talk about some successful treatments for people who have significant anxiety.
Well, luckily, there's a lot of hope out there. Helpful treatments have been increasing in recent years. And the most successful therapy is called cognitive behavioral therapy, or CBT, which helps some people deal with their patterns of thinking, which we understand is connected to how they behave and, in the end, how they feel. And so there are other therapies, too, like mindfulness and relaxation therapies. But medications can often be helpful. Those medications, which often treat depression, also treat anxiety, but certain medications are important to be careful about, particularly benzodiazepines like Valium, Klonopin, and especially Xanax. While they behave very differently than the opioid drugs that have been in the news lately, similarly, they do have habit-forming properties, which can lead to more anxiety. So you want to be careful about that and follow your provider's recommendations.
All right, Dr. Newfield, thank you so much for the very latest. We appreciate it.
Thanks, Lisa.